Hello, welcome back to Simply Women's Health with CeeJay. Today we're going to talk about week 16 of your pregnancy. You are now officially in your fourth month. Some of you are probably starting to look a little bit pregnant. If this is your first baby and you are not showing yet, it is absolutely fine. You still have excellent abdominal tone. Those first trimester hormone levels are really tapering off now. You have probably noticed an increase in your energy level. You're definitely hungrier now than you were a month ago. That placenta is still making lots of estrogen. That increased estrogen can cause more headaches than you're used to. It can cause an increase in your vaginal discharge. As long as that discharge isn't green, stinky, or itchy, it's absolutely fine. You have more progesterone. The progesterone leads to increased constipation, nasal congestion, swollen gums. As that uterus is starting to expand, your tummy may be itchy, you may be getting some stretch marks. I expect you to have frequent cramping. Those are called Braxton Hicks. They are completely harmless. Round ligament pain, stretching pains that occur down deep in your uterus every time you make a sudden movement, again, very normal. Some of you may be feeling that baby moving at this point. If this is your first baby, probably not. But if it's not your first baby, you may be feeling those little flutters. So inside your uterus, your little human is now measuring about 7 inches long, or about the same size as a banana, and now weighs just over 5 ounces, or about the same as that smartphone in your hand. This week, your baby is developing hair follicles, toenails, the eyes and ears are being formed. The baby's heart is beating about 120 to 160 times per minute. If you have an ultrasound this week, your provider is probably going to be able to tell if you're having a boy or a girl. What's not okay at this point? Bright red bleeding that's enough to saturate a pad, cramping that won't go away. It's not normal for you to have severe pain of any kind that is persistent. If you have itching on the palms of your hand or the soles of your feet, that is something you would need to notify your OB provider about. If you have an OB visit scheduled this week, your provider will probably be able to hear the baby's heartbeat with a Doppler. They may offer you a genetic test called an alpha-fetoprotein. The alpha-fetoprotein is a time-sensitive test. It has to be done between 15 and 21 weeks of pregnancy. The purpose of this test is to see if your baby is at increased risk to have a neural tube defect. They will probably schedule your anatomy scan. That is an ultrasound that is done typically between 18 and 22 weeks. They look the baby over head to toe to make sure everything is fine. What should you be doing at this point? I encourage you to schedule a dental appointment and have those teeth cleaned. Start documenting this pregnancy. Take pictures of that bump. Make sure you're following a healthy diet, fruits and vegetables, whole grain breads and cereals, lean meat. Drink lots and lots of water. If you are thirsty, you are dehydrated, take a prenatal vitamin. I encourage you to exercise on a regular basis, walking, swimming, prenatal yoga. Have sex unless you've been told not to. Go on that vacation. Remember, you're not sick, you're pregnant. Live your life. If you have questions for me, please drop them in the comment section below. I'd love to hear from you. While you're there, go ahead and hit that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your cervix.